Question 1. John has been working as a psychiatric rehabilitation practitioner for 5 years. He recently began utilizing the recovery-oriented practice model, but one of his colleagues argues that the medical model is still more effective for managing patients with chronic psychiatric disorders. What is the key reason why John's approach is more appropriate for the recovery of individuals with long-term mental health conditions? A. The medical model focuses on diagnosing and treating symptoms, which is more effective in stabilizing individuals with chronic conditions. B. Recovery-oriented practice emphasizes holistic, person-centered approach that prioritizes the individual's recovery journey, autonomy, and community involvement. C. The medical model provides better support for individuals transitioning from psychiatric institutions to independent living arrangements. D. Recovery-oriented practice has less emphasis on medication management, which leads to slow recovery for individuals with chronic conditions. Answer. B. Recovery-oriented practice emphasizes a holistic, person-centered approach that prioritizes the individual's recovery journey, autonomy, and community involvement. Explanation. Recovery-oriented practice (ROP) focuses on empowering individuals with psychiatric disorders to manage their own recovery. It emphasizes autonomy, the importance of social roles, and community integration. This approach is essential for individuals with long mental health conditions, as it fosters personal growth and participation in meaningful life activities. In contrast, the medical model is more focused on symptom reduction and the clinical management of conditions, which, while important for stabilization, does not provide the long-term empowerment and community integration that ROP fosters. By focusing on the person as whole, recovery-oriented practices enable more sustainable long-term outcomes. Question 2. Samantha is a psychiatric rehabilitation practitioner who is working with a client who has been diagnosed with bipolar disorder. Her client experiences periods of depression and mania, making it difficult to maintain stability in their personal life and employment. Samantha decides to use cognitive behavioral therapy (CBT) in her work with this client. Which of the following would be the primary goal of CBT in this scenario? A. To explore the client's childhood to uncover the root cause of their bipolar disorder. B. To help the client identify and change negative thought patterns and behaviors that contribute to their mood swings. C. To offer medication recommendations that may alleviate the client's symptoms. D. To encourage the client to isolate themselves from social situations to reduce stress and mood swings. Answer. B. To help the client identify and change negative thought patterns and behaviors that contribute to their mood swings. Explanation. Cognitive behavioral therapy (CBT) is an evidence-based therapeutic approach that focuses on helping individuals identify and challenge negative thought patterns and behaviors that contribute to emotional distress. For a client with bipolar disorder, CBT helps them recognize how negative, distorted thinking can trigger mood swings and implement coping strategies to manage their symptoms. Unlike other therapies that may delve into the past, CBT focuses on the present and offers practical strategies for managing the disorder in daily life. This makes it an effective intervention for those with mood disorders such as bipolar disorder, particularly when it comes to preventing or managing depressive and manic episodes. Question 3. Scenario-based. James, a psychiatric rehabilitation practitioner, is working with an individual named Sarah who is recovering from a substance use disorder alongside generalized anxiety disorder. Sarah has expressed that she feels overwhelmed by her mental health conditions and struggles to find stable employment. James wants to help Sarah achieve her goal of finding meaningful work, but is concerned that her anxiety may be preventing her from engaging in a vocational rehabilitation program. What should James do first to support Sarah in this situation? A. Encourage Sarah to immediately start applying for jobs in her area of interest to reduce her anxiety. B. Assess Sarah's current functional abilities and anxiety triggers to develop a tailored plan that builds her confidence and readiness for employment. C. Refer Sarah to a psychiatric institution for further evaluation and management of her anxiety disorder. D. Advise Sarah to focus solely on her recovery from substance use before employment opportunities. Answer. B. Assess Sarah's current functional abilities and anxiety triggers to develop a tailored plan that builds her confidence and readiness for employment. Explanation. In psychiatric rehabilitation, it is crucial to take a person-centered approach. James should first conduct an assessment of Sarah's current functional abilities, including identifying specific triggers for her anxiety and how they may impact her readiness for employment. Tailored vocational that takes into account her mental health condition can then be developed which may involve gradually building work readiness, addressing anxiety through strategies such as cognitive behavioral techniques, and considering job accommodations. It is important not to rush Sarah into applying for jobs without addressing her specific challenges. Encouraging her to work at her own pace while building confidence will ultimately help her achieve sustainable success in recovery and employment. Question 4. Maria, a psychiatric rehabilitation practitioner, is working with a client named Tom who has been diagnosed with schizophrenia. Tom often experiences auditory hallucinations that interfere with his daily activities and social interactions. Maria wants to use a therapeutic intervention that would help Tom better manage his symptoms and improve his ability to function in social settings. Which of the following interventions would be appropriate for Tom? A. Group therapy sessions focused on confronting his delusions head-on to challenge his beliefs. B. Cognitive behavioral therapy CBT to help him identify and cope with distressing thoughts and hallucinations. C. Family therapy to help his relatives understand the nature of his illness and provide better support. D. Psychoeducation to explain the nature of schizophrenia but not address how to manage specific symptoms. Answer. B. Cognitive behavioral therapy CBT to help him identify and cope with distressing thoughts and hallucinations. Explanation. Cognitive behavioral therapy CBT is effective for individuals with schizophrenia in addressing distressing symptoms such as hallucinations and delusions. The primary goal of CBT in this context is to help Tom recognize the connection between his thoughts, feelings, and behaviors, and teach him mechanisms to manage the hallucinations. CBT does not focus on confronting delusions directly, but instead helps individuals reframe their experiences and manage the emotional distress associated with them. Family therapy and psychoeducation can also be beneficial, but they do not specifically address Tom's symptoms in the same direct, therapeutic way that CBT does. Question 5. In the context of psychiatric rehabilitation, what is the primary goal of person-centered planning? A. To develop a standardized treatment plan for all clients based on diagnostic criteria. B. To create a treatment plan that solely addresses the clinical aspects of a client's mental health disorder. C. To involve the individual in the planning process, focusing on their strengths, preferences, and personal goals for recovery. D. To ensure that the client receives intensive medical interventions based on their diagnosis. Answer. C. To involve the individual in the planning process, focusing on their strengths, preferences, and personal goals for recovery. Explanation. Person-centered planning is a fundamental principle in psychiatric rehabilitation. It involves the client as an active participant in the process of creating a treatment or rehabilitation plan that is tailored to their unique preferences, strengths, and goals. This approach acknowledges the individual's autonomy. Recovery journey, aiming to empower them to make decisions about their care and how they wish to live their lives. While the clinical aspects of mental health are considered, the focus is on personal goals rather than solely on medical interventions or diagnostic criteria. This holistic approach aligns with recovery-oriented practices, ensuring that the individual's voice is central to their recovery process. Question 6. Which of the following is a key benefit of supported employment programs for individuals with psychiatric disabilities? A. Supported employment guarantees that individuals will immediately secure permanent full-time positions. B. Supported employment programs provide intensive training on job-specific skills, but no additional workplace accommodations are offered. C. Supported employment helps individuals with psychiatric disabilities to secure and maintain employment by offering job coaching, workplace accommodations, and continuous support. D. Support employment only focuses on individuals who are already employed, helping them to maintain their current jobs. Answer. C. Supported employment helps individuals with psychiatric disabilities to secure and maintain employment by offering job coaching, workplace accommodations, and continuous support. Explanation. Supported employment is designed to assist individuals with psychiatric disabilities in finding and maintaining competitive employment. This approach includes job coaching, workplace accommodations, and ongoing support to ensure individuals exceed in their jobs. The goal is not only to help the individual secure a job, but to ensure long-term success by addressing any barriers related to their mental health. Unlike programs that focus solely on job-specific training or those that do not offer accommodations, supported employment takes a comprehensive, individualized approach to address both the challenges faced by individuals with psychiatric disabilities and the needs of employers. Question 7. Jill, a psychiatric rehabilitation practitioner, is working with a client named Luke who has a history of trauma and is currently diagnosed with post-traumatic stress disorder (PTSD). Luke is also struggling with a substance use disorder. What is the most important approach Jill should take when working with Luke, considering his dual diagnosis? A. Treat a PTSD and substance use disorder separately, focusing on one issue at a time. B. Use a trauma-informed care approach that addresses both the PTSD and substance use disorder simultaneously. C. Prioritizes substance use disorder treatment over PTSD as it is the most pressing issue. D. Focus primarily on managing Luke's PTSD symptoms and assume the substance use disorder will improve on its own. Answer. B. Use a trauma-informed care approach that addresses both PTSD and substance use disorder simultaneously. Explanation. When working with individuals who have a dual diagnosis such as PTSD and substance use disorder, it is essential to take an integrated approach that considers both conditions simultaneously. Trauma-informed care emphasizes the importance of understanding the impact of trauma on the individual's mental health and the need for interventions that avoid re-traumatization. This approach helps clients develop coping mechanisms that are sensitive to their trauma history and provides a foundation for addressing both the PTSD and substance use disorder together. Treating each condition separately or focusing on one at the expense of the other is less effective and may hinder the individual's overall recovery. Question 8. Which of the following is a key ethical consideration in psychiatric rehabilitation practice when working with individuals who have mental health disorders? A. Ensuring that treatment decisions are made solely by the practitioner to avoid confusion for the client. B. Balancing the individual's right to autonomy with the need for protective interventions when their safety is at risk. C. Encouraging clients to follow the practitioner's advice without involving them in decision-making. D. Keeping all personal and clinical information about the client confidential regardless of any legal requirements to disclose. Answer. B. Balancing the individual's right to autonomy with the need for protective interventions when their safety is at risk. Explanation. In psychiatric rehabilitation, ethical considerations play a critical role in ensuring that the practitioner respects the autonomy and rights of the individual while also addressing issues related to safety and well-being. Practitioners must balance the client's right to make decisions about their own care with the responsibility to intervene when the client's safety is at risk, such as in cases of suicidal ideation or severe self-harm. This balance is crucial for maintaining ethical standards while fostering an environment of trust and respect for the individual's choices. It is also important to adhere to confidentiality guidelines, but legal requirements, such as mandatory reporting in cases of harm, must always take precedence. Question 9. A client named Henry is working with a psychiatric rehabilitation practitioner to improve his social functioning. Henry has been diagnosed with social anxiety disorder, which impacts his ability to interact with others in group settings. The practitioner decides to use social skills training (SSD) as part of his rehabilitation plan. Which of the following is the primary focus of SSD in this case? A. To encourage Henry to avoid social interactions until he feels more confident. B. To help Henry learn specific communication techniques and coping strategies for engaging in social situations. C. To place Henry in large group settings to help him confront his anxiety. D. To ensure that Henry is prescribed medication that will alleviate his social anxiety symptoms. Answer. B. To help Henry learn specific communication techniques and coping strategies for engaging in social situations. Explanation. Social skills training (SSD) is designed to help individuals with social anxiety or other social functioning difficulties by teaching specific skills for managing social interactions. In this case, the primary goal of SSD is to help Henry develop communication techniques and coping strategies that he can use in social situations to feel more confident and less anxious. This approach focuses on gradually building skills and providing opportunities for practice in safe, controlled environments. It does not involve avoidance of social interactions or relying solely on medication. Through SSD, Henry will be better equipped to navigate social settings effectively, ultimately improving his social functioning and quality of life. Question 10. In the context of psychiatric rehabilitation, what is the role of advocacy in supporting individuals with psychiatric disorders? A. Advocacy solely involves making legal decisions for the individual. B. Advocacy ensures that individuals have access to resources, services, and opportunities that support their recovery and well-being. C. Advocacy is limited to helping individuals secure housing and employment. D. Advocacy focuses primarily on managing financial matters for individuals with psychiatric disorders. Answer: B. Advocacy ensures that individuals have access to resources, services, and opportunities that support their recovery and well-being. Explanation: Advocacy in psychiatric rehabilitation is a vital part of supporting individuals with mental health disorders. It involves helping clients gain access to the resources, services, and opportunities they need for recovery, such as healthcare, housing, employment, and social support. Advocacy also includes supporting the individual in navigating complex systems, including legal, medical, and social services, to ensure they receive the necessary care and assistance. Effective advocacy empowers individuals to make informed decisions about their treatment and life, fostering independence and self-determination. It is a broader concept than simply securing employment or financial support. Question 11. Which of the following is a primary goal of cognitive rehabilitation therapy (CRT) or individuals with cognitive impairments related to mental health disorders? A. To eliminate cognitive impairments entirely through medical interventions. B. To focus solely on enhancing memory and attention without addressing other cognitive functions. C. To help individuals develop strategies to compensate for cognitive deficits and improve functional independence. D. To teach clients to avoid situations that could challenge their cognitive abilities. Correct answer: C. To help individuals develop strategies to compensate for cognitive deficits and improve functional independence. Explanation: Cognitive rehabilitation therapy (CRT) is designed to help individuals with cognitive impairments, e.g., memory, attention, executive function, develop strategies to compensate for these deficits. The goal is not to eliminate the impairments entirely, but to help the individual adapt, function more independently in daily life. CRT focuses on enhancing cognitive skills and teaching compensatory techniques to improve overall functioning. This holistic approach addresses a broad range of cognitive functions and emphasizes practical applications rather than avoidance of challenging situations. Question 12. Jared, a client with bipolar disorder, has recently experienced a manic episode that led to risky behavior and strained relationships. As part of his rehabilitation plan, the psychiatric rehabilitation practitioner is working with him to develop skills that can help him manage his mood and avoid relapse. Which of the following approaches would be most effective in helping Jared manage his manic episodes? A. Encouraging Jared to avoid all social interactions to prevent overstimulation. B. Focusing on mood stabilization through a combination of medication management and psychoeducation. C. Asking Jared to continue engaging in risky behavior to build his confidence. D. Focusing solely on addressing his depression, assuming the mania will resolve on its own. Answer: B. Focusing on mood stabilization through a combination of medication management and psychoeducation. Explanation: Managing bipolar disorder, particularly during manic episodes, requires a comprehensive approach that includes mood stabilization through medication management and psychoeducation. Medication is often necessary to stabilize mood, while psychoeducation helps the client understand their condition, recognize early signs of mood changes, and develop coping strategies. Avoiding social interactions or engaging in risky behaviors would not be effective in managing the disorder. Focusing solely on depression overlooks the importance of stabilizing both phases of the mood disorder. Question 13. Which of the following best describes a key feature of a recovery-oriented approach in psychiatric rehabilitation? A. Focusing solely on symptom reduction to improve functioning. B. Prioritizing the individual's preferences, strengths, and goals in the recovery process. C. Providing clients with a one-size-fits-all treatment plan that addresses all possible mental health issues. D. Focusing exclusively on the clinical aspects of the individual's mental health condition. Answer: B. Prioritizing the individual's preferences, strengths, and goals in the recovery process. Explanation: A recovery-oriented approach in psychiatric rehabilitation emphasizes the importance of the individual's personal preferences, strengths, and goals. This approach recognizes that recovery is a unique, individualized process and supports the person in defining their own goals for a meaningful life, while symptom reduction is part of recovery. Recovery-oriented approach also focuses on social integration, personal empowerment, and hope. It avoids a one-size-fits-all model and encourages collaboration between the client and practitioner. Question 14. Sarah is a psychiatric rehabilitation practitioner working with a client named Alex who has been diagnosed with depression and has limited social support. As part of his treatment plan, Sarah decides to introduce a peer support program to help him feel more connected to others. What is the primary benefit of peer support in this context? A. It provides a professional therapist for one-on-one counseling sessions. B. It connects individuals with others who have experienced similar challenges, offering emotional support and shared coping strategies. C. It removes the need for clinical interventions such as medication or therapy. D. It allows individuals to isolate themselves from those who do not understand their mental health struggles. Answer. B. It connects individuals with others who have experienced similar challenges, offering emotional support and shared coping strategies. Explanation. Peer support is an effective intervention for individuals with mental health challenges because it provides an opportunity to connect with others who have shared similar experiences. This can be incredibly validating and helpful for emotional support. Peer support programs often offer encouragement, coping strategies, and a sense of community, which can improve the individual's feelings of isolation and promote a sense of belonging. Unlike professional therapy, peer support focuses on mutual assistance rather than clinical interventions, though it complements formal treatment. Question 15. What is the primary purpose of vocational rehabilitation programs for individuals with mental health disorders? A. To offer temporary job placement services for individuals without long-term career goals. B. To provide individuals with mental health disorders the skills and support needed to achieve and maintain meaningful employment. C. To limit individuals' employment opportunities to part-time, low-stress positions to avoid exacerbating symptoms. D. To help individuals with mental health disorders find volunteer opportunities as way to Answer. B. To provide individuals with mental health disorders the skills and support needed to achieve and maintain meaningful employment. Explanation. Vocational rehabilitation programs are designed to help individuals with mental health disorders gain the skills, confidence, and support they need to find and maintain meaningful employment. These programs typically offer a variety of services, including job coaching, skill development, career counseling, and assistance with workplace accommodations. The goal is to empower individuals to achieve independence through employment, fostering greater self-sufficiency and community integration. Unlike temporary job placement or part-time roles, vocational rehabilitation focuses on long-term employment success. Question 16. In a psychiatric rehabilitation setting, which of the following best describes the role of a case manager in helping clients with serious mental illness? SMI. A. To provide psychiatric medications to clients under the supervision of a psychiatrist. B. To coordinate care and services, ensuring clients receive the appropriate treatments, supports, and resources to meet their recovery goals. C. To work exclusively on crisis management and avoid addressing long-term rehabilitation needs. D. To act as a counselor providing one-on-one therapy to clients with mental health conditions. Answer. B. To coordinate care and services, ensuring clients receive the appropriate treatments, supports, and resources to meet their recovery goals. Explanation. The role of a case manager in psychiatric rehabilitation is primarily to coordinate care and services across various domains, ensuring clients with serious mental illness (SMI) receive the necessary treatments, resources, and supports to achieve their recovery goals. Case managers collaborate with other healthcare providers, community resources, and the client support system to help facilitate treatment and address barriers to recovery. Case managers do not typically provide psychiatric medications or one-on-one therapy, which are handled by clinicians such as psychiatrists or therapists. Question 17. Which of the following strategies is most likely to promote community integration for individuals with psychiatric disabilities? A. Encouraging clients to withdraw from social situations that cause stress or discomfort. B. Engaging clients in social and recreational activities that foster relationships and build community connections. C. Focusing exclusively on symptom management without addressing social needs or engagement. D. Limiting social interactions to mental health support groups only where individuals with similar diagnoses interact. Answer. B. Engaging clients in social and recreational activities that foster relationships and build community connections. Explanation: community integration involves supporting individuals with psychiatric disabilities to participate in meaningful social, recreational, and community activities that foster relationships, enhance their social networks, and build a sense of belonging. By encouraging participation in community activities, individuals can develop skills, create support systems, and reduce feelings of isolation. While symptom management is important, it should not be the sole focus of rehabilitation, and social engagement with diverse groups beyond support groups is critical for holistic recovery. Question 18. Jessica, a psychiatric rehabilitation practitioner, is working with Tom, who has schizophrenia. Tom has expressed a desire to return to work but is worried about his ability to manage stress and maintain focus in the workplace. Which of the following interventions would be most appropriate for Jessica to implement to help Tom with his goal? A. Assigning Tom to a low-stress, non-demanding job without any additional support. B. Encouraging Tom to work with a vocational rehabilitation counselor to develop stress management skills and job coaching for sustained employment. C. Focusing only on Tom's social interactions and ignoring the workplace-related concerns. D. Providing Tom with a list of possible jobs and asking him to apply independently. Answer: B. Encouraging Tom to work with a vocational rehabilitation counselor to develop stress management skills and job coaching for sustained employment. Explanation: in this case, Tom's concern about managing stress and maintaining focus in the workplace is a key issue that needs to be addressed in vocational rehabilitation plan. Working with vocational rehabilitation counselor to develop stress management skills and providing job coaching will help build the skills needed to succeed in the workplace. This approach also addresses his specific concerns, increasing the likelihood of sustained employment. Simply assigning him to job without support or ignoring his workplace-related issues would likely lead to unsuccessful outcomes. Question 19. Which of the following ethical principles is central to maintaining professional boundaries in psychiatric rehabilitation? A. Autonomy, supporting clients' right to make decisions for themselves. B. Beneficence, acting in the best interest of clients at all times. C. Non-maleficence, avoiding harm or exploitation of clients. D. Justice, ensuring all clients receive equal treatment regardless of their needs. Answer: C. Non-maleficence, avoiding harm or exploitation of clients. Explanation: non-maleficence, the ethical principle of do no harm, is central to maintaining professional boundaries in psychiatric rehabilitation. It requires practitioners to avoid any actions that could harm or exploit clients, which is a critical consideration when working with vulnerable populations such as those with mental health disorders. Practitioners must ensure that interactions with clients are respectful and supportive, never taking advantage of their situation. While autonomy, beneficence, and justice are also important ethical principles, non-maleficence directly addresses the potential harm that could arise from boundary violations. Question 20. A psychiatric rehabilitation practitioner is helping a client with a dual diagnosis of schizophrenia and substance use disorder. The client has been in and out of treatment for both conditions and has expressed frustration at the lack of progress. Which of the following approaches is most likely to enhance the client's long-term recovery? A. Focusing exclusively on treating the substance use disorder, since that is the more urgent issue. B. Addressing both the mental health and substance use disorders simultaneously in an integrated treatment plan. C. Focusing only on stabilizing the client's schizophrenia symptoms, assuming the substance use will improve over time. D. Providing brief interventions for the substance use disorder without integrating it into the overall treatment plan for schizophrenia. Answer: B. Addressing both the mental health and substance use disorders simultaneously in an integrated treatment plan. Explanation: the most effective treatment approach for individuals with a dual diagnosis, both mental health and substance use disorders, is an integrated treatment plan that addresses both conditions simultaneously. Treating only one of the disorders without considering the other increases the risk of relapse and poor outcomes. Integrated treatment allows for coordinated care that addresses the complex interaction between the disorders and provides a comprehensive approach to recovery. Focusing exclusively on one disorder or assuming the other will resolve on its own is unlikely to lead to long-term success. Question 21. Which of the following is the key benefit of using a strength-based approach in psychiatric rehabilitation? A. It helps clients focus on their deficits and limitations in order to address them directly. B. It empowers clients to build on their existing skills and resources, enhancing self-efficacy and recovery. C. Encourages clients to avoid addressing difficult emotions or challenges to preserve their mental well-being. D. It relies on a clinical model that prioritizes medical interventions to address psychiatric symptoms. Answer B. It empowers clients to build on their existing skills and resources, enhancing self-efficacy and recovery. Explanation. A strength-based approach focuses on empowering clients by identifying and building upon their existing skills, abilities, and resources. This approach enhances the client's self-efficacy or belief in their ability to make positive changes, which is crucial for promoting recovery. It contrasts with deficit-based approaches, focus on what clients cannot do. By leveraging strengths, this approach increases client engagement, motivation, and resilience in overcoming challenges. It does not avoid difficult emotions, but encourages clients to use their strengths to navigate and manage these emotions effectively. Question 22. John, a psychiatric rehabilitation practitioner, is working with Maria, who has bipolar disorder. Maria often experiences periods of intense depression and mania, making it challenging for her to maintain stable employment. Which of the following strategies would be most effective for John to support Maria's vocational goals? A. Assigning Maria a part-time job that requires minimal social interaction during her depressive episodes. B. Encouraging Maria to focus solely on managing her manic episodes and ignoring the depressive phases. C. Collaborating with Maria to develop flexible work schedule with accommodations for both her depressive and manic episodes. D. Suggesting that Maria refrain from working until she has achieved complete symptom stability. Answer C. Collaborating with Maria to develop a flexible work schedule with accommodations for both her depressive and manic episodes. Explanation. Supporting individuals with bipolar disorder in achieving vocational success requires a flexible, individualized approach. Collaborating with Maria to develop a flexible work schedule allows her to manage both depressive and manic episodes while maintaining employment. This strategy is realistic, takes into account the fluctuating nature of her symptoms. Accommodations might include adjusted hours, reduced workload during depressive episodes, or adjustments during manic episodes to prevent exacerbating symptoms. Simply assigning her a part-time job or suggesting that she refrain from work entirely does not address the dynamic nature of her condition or her vocational aspirations. Question 23. Which of the following is a key component of trauma-informed care in psychiatric rehabilitation? A. Treating all clients using a uniform approach without taking into account individual histories of trauma. B. Prioritizing the client's safety and ensuring that all services are delivered in supportive, non-traumatizing environment. C. Encouraging clients to immediately confront and process their traumatic experiences to promote healing. D. Focusing solely on the psychiatric symptoms and ignoring potential trauma-related issues. Answer. B. Prioritizing the client's safety and ensuring that all services are delivered in supportive, non-traumatizing environment. Explanation. Trauma-informed care is centered around the understanding that many clients in psychiatric rehabilitation have experienced trauma. Key component of trauma-informed care is prioritizing the client's safety and ensuring that the therapeutic environment is supportive, respectful, and non-traumatizing. This recognizes the impact of trauma on individuals and incorporates that understanding into all aspects of treatment and care. Encouraging clients to immediately confront trauma or focusing solely on symptoms would not create safe, supportive space for healing and may exacerbate their distress. Question 24. In psychiatric rehabilitation, the principle of person-centered planning is most likely to involve which of the following actions? A. Developing treatment plans solely based on clinical diagnosis without involving the client's input. B. Using standardized, one-size-fits-all treatment approach to ensure consistency across clients. C. Collaborating with clients to set goals and make decisions that reflect their personal values, preferences, and strengths. D. Focusing exclusively on the immediate psychiatric symptoms without considering the client's broader life goals. Answer. C. Collaborating with clients to set goals and make decisions that reflect their personal values, preferences, and strengths. Explanation. Person-centered planning places the client at the center of the decision-making process, ensuring that their goals, values, and preferences are prioritized in treatment planning. This approach recognizes that each individual is unique and involves collaboration between the practitioner and the client to create a treatment plan that reflects their strengths, needs, and life goals. It contrasts with more traditional, provider-driven approaches where the client has limited input in their treatment. The goal is to empower the client and involve them actively in their rehabilitation process. Question 25. Which of the following is a primary challenge in providing vocational rehabilitation for individuals with dual diagnoses, co-occurring mental health and substance use disorders? A. Both conditions must be treated independently with no overlap in treatment strategies. B. Clients often experience exacerbation of symptoms when addressing both conditions simultaneously, making it difficult to maintain employment. C. There are no effective employment supports for individuals with dual diagnoses. D. Clients with dual diagnoses are unlikely to benefit from vocational rehabilitation interventions. Answer. B. Clients often experience exacerbation of symptoms when addressing both conditions simultaneously, making it difficult to maintain employment. Explanation. The primary challenge in providing vocational rehabilitation for individuals with dual diagnoses is managing the complex interaction between mental health and substance use disorders. Addressing both conditions simultaneously can lead to the exacerbation of symptoms, making it difficult for clients to maintain employment. Successful vocational rehabilitation requires an integrated treatment approach that addresses both disorders concurrently. This may involve coordinating mental health support, substance use treatment, and vocational training or job support. Treating the conditions independently without overlap in treatment strategies would likely lead to poorer outcomes. Question 26. Which of the following is a core principle of the recovery-oriented approach in psychiatric rehabilitation? A. Focusing solely on symptom reduction as the primary goal of treatment. B. Viewing individuals as passive recipients of care rather than active participants in their recovery. C. Encouraging individuals to take control of their recovery and make decisions about their treatment. D. Using a standardized clinical approach to address mental health disorders without considering the individual's personal goals. Answer. C. Encouraging individuals to take control of their recovery and make decisions about their treatment. Explanation. The recovery-oriented approach emphasizes empowering individuals to take an active role in their own recovery process. This approach views individuals as active participants who can make informed decisions about their treatment based on their personal goals, values, and preferences. It contrasts with traditional models that focus solely on symptom reduction or a passive role for the individual. Recovery-oriented practices prioritize hope, self-determination, and the involvement of the individual in all aspects of their rehabilitation, including treatment planning and decision-making. Question 27. Maria has been living with schizophrenia for several years, and her symptoms include auditory hallucinations and disorganized thinking. As part of her rehabilitation plan, she is engaged in cognitive remediation therapy. Which of the following best describes the primary goal of cognitive remediation therapy in this context? A. To reduce the severity of her psychotic symptoms through medication adjustments. B. To help Maria develop coping skills for managing stress and anxiety in social situations. C. To enhance Maria's cognitive functioning and improve skills in areas such as attention, memory, and executive function. D. To encourage Maria to accept her diagnosis and focus on symptom management through structured therapy. Answer. C. To enhance Maria's cognitive functioning and improve skills in areas such as attention, memory, and executive function. Explanation. Cognitive remediation therapy (CRT) is designed to improve cognitive functioning, particularly in areas such as attention, memory, and executive functioning. This type of therapy is particularly useful for individuals with conditions like schizophrenia, where cognitive deficits can significantly impact functioning. By improving cognitive skill, ERT helps individuals enhance their ability to engage in social, vocational, and community activities. While medications are an essential part of managing psychotic symptoms, CRT specifically targets cognitive impairments which are often less responsive to medication alone. Question 20. Sarah, a psychiatric rehabilitation practitioner, is working with Mark, a client diagnosed with severe depression and a history of substance use. Mark has expressed interest in pursuing a part-time job but is worried that his depressive symptoms will interfere with his ability to maintain employment. What would be the most appropriate first step for Sarah to take in assisting Mark with his vocational goals? A. Immediately secure a job placement for Mark as his depressive symptoms may improve with work. B. Collaborate with Mark to develop a plan that addresses both his depression and substance use issues while considering his job preferences and readiness. C. Advise Mark to avoid working until his depression is completely resolved. D. Focus exclusively on his depression symptoms before discussing vocational rehabilitation. Answer: B. Collaborate with Mark to develop a plan that addresses both his depression and substance use issues while considering his job preferences and readiness. Explanation: the most effective way to assist Mark in pursuing vocational goals is through a holistic, person-centered approach that addresses both his mental health and substance use issues. Collaborating with Mark to develop a plan that integrates his job preferences, strengths, and readiness for work. Essential. It is also important to consider accommodations or modifications that may support his mental health while engaging in employment. Simply securing a job without addressing these factors may lead to burnout or further exacerbation of his symptoms. Avoiding work entirely would not support his vocational aspirations, and focusing exclusively on depression before addressing vocational goals neglects a comprehensive, recovery-oriented approach. Question 29. Which of the following is a key characteristic of effective case management in psychiatric rehabilitation? A. Case managers should work independently and make decisions for clients without involving them in the process. B. Case managers focus primarily on clinical interventions, disregarding social or vocational needs. C. Case managers collaborate with a team of professionals, community resources, and clients to create and implement comprehensive service plans. D. Case managers should avoid discussing the client's long-term goals as they are to change over time. Answer: C. Case managers collaborate with a team of professionals, community resources, and clients to create and implement comprehensive service plans. Explanation: effective case management in psychiatric rehabilitation is built on collaboration. Case managers work with a multidisciplinary team including healthcare providers, community resources, and the client themselves to develop a holistic and person-centered service plan. This approach ensures all aspects of the client's needs, clinical, social, vocational, and personal, are addressed. It also promotes client empowerment as they are actively involved in the planning and decision-making process. Working independently or focusing solely on clinical interventions without considering the client's broader needs would not support effective rehabilitation. Additionally, discussing long-term goals with clients is essential as it fosters motivation and direction their recovery journey. Question 30. The principle of social role valorization in psychiatric rehabilitation aims to A. ensure that clients with psychiatric disabilities remain isolated to minimize stress and complications. B. Promote societal inclusion by enhancing the perceived value of individuals with psychiatric disabilities in society. C. Focus solely on symptom management, disregarding social roles or integration. D. Encourage client conform to societal norms, regardless of their individual needs and preferences. Answer: B. Promote societal inclusion by enhancing the perceived value of individuals with psychiatric disabilities in society. Explanation: social role valorization (SRV) is a principle that emphasizes the importance of societal inclusion for individuals with psychiatric disabilities. The goal is to enhance the perceived value of these individuals by promoting social roles that are valued in society, such as employment, family roles, community involvement. SRV advocates for breaking down societal barriers that may contribute to stigmatization or marginalization, helping individuals with psychiatric disabilities engage fully in society. It does not encourage isolation or conformity without regard to individual needs, and it goes beyond merely focusing on symptom management to address broader social inclusion and empowerment.